At MetroEHS Pediatric Therapy, we have been helping children all over Metro Detroit with problems with picky eating.
You know, every kid at 5 is a picky eater. All they want is chicken nuggets. It's that's what they do. You know, it's time for dinner. I don't want to eat. You have to eat. I don't want that. It smells funny in here. In particular for my son, it was not just about the food, it was about his anxiety leading up to eating.
As a speech-language pathologist, I assess and provide intervention to children who have feeding impairments. This could also be children who have difficulty with eating a variety of foods. So they might be what we call picky eaters. They have difficulty or they have only a specific type of food that they really like to eat, as well as children who might have neurological difficulties and then subsequently have deficits with swallowing.
A good example of this would be a case that I worked on this week with a kiddo who has severe sensory processing disorder and sensory defensiveness. This is causing an issue with her ability to eat all food.
Because they are not comfortable with some of the foods that are important to them, we actually initially get them to start playing with the food, playing with the utensils, pouring water into cups or into a bin full of beans, and then start putting some of the food, rubbing it around their mouth, just plain old messy play, because that's what kids want to do. That's part of their business. So we incorporate that into our feeding and swallowing technique. And then gradually, slowly but surely, we work on getting them into their mouths.
You tried it.
In addition, we have a nutritionist or a dietitian that works with the families from the beginning. She'll be working with you as we gradually expand the repertoire of foods that the child is embracing.
It's a whole world of this therapy that can address his feeding concern, his gagging concern. He's willingly eating broccoli. What 5-year-old willingly eats broccoli? Mine does now, and that's a big step. MetroEHS has made that transition so much easier.